As of 9 p.m. today, 9 people have died from the new type of coronavirus, and 473 cases have been confirmed in China. According to Chinese health officials, all deaths occurred in Hubei, of which Wuhan is the provincial capital. Now, Bei gives us the details.
Of course, Chen Xuan. So far, 17 provinces in China, 2 autonomous regions, 4 municipalities, Hong Kong, Macau, and Taiwan, have all reported confirmed or suspected cases of the new coronavirus. The Hong Kong SAR confirmed the first case today, who said the patient had been to Wuhan and arrived on a train last night from the mainland and was sent to hospital in Hong Kong. The Macau SAR government said today that the first case of novel coronavirus has been reported in a local hospital. The 52-year-old woman traveling from Wuhan is being quarantined and treated. Taiwan has also reported 1 confirmed case so far. 375 confirmed cases were reported in Wuhan, where the National Health Commission said the pathogen was first discovered in December. Officials say it was a major concern due to the ongoing Spring Festival travel rush, when hundreds of millions of people travel in packed buses, trains, and planes to visit their loved ones.
There have been instances of human-to-human transmission and infections among medical workers. Some transmission across neighborhoods has also been reported. The virus is likely to be spread through respiratory systems, and it is likely to mutate. The risk of further spread of the disease remains.
In response to online rumors about the super spreader who infected 14 medical workers, the country's top health authority says there is no evidence so far to support the claim.
We are in a process of studying this new coronavirus, so we haven't collected evidence saying there is a super spreader, but we are closely monitoring the risk of possible super spreaders. When designing preventative measures against the virus, intense efforts have been devoted to control possible cases of super spreaders.
A report by the MRC Center for Global Infectious Disease Analysis at Imperial College London estimated there could be more than 1,700 infections. Gao said the result is calculated based on a model rather than facts. The Hubei provincial government activated a level 2 public health emergency today, the second highest in the country. The city has tightened control and monitoring of outbound travelers by banning tour groups out of Wuhan and conducting spot checks for live poultry or wild animals in vehicles leaving and entering the city. Free diagnosis and treatment of coronavirus are being offered in Wuhan. About 2,000 beds will be allocated for patients in designated hospitals. There are 61 listed fever clinics in Wuhan. WHO officials are in Wuhan this week to check the situation.
The Spring Festival is approaching. Wuhan has more than 5 million people leaving the city, and many will come back to Wuhan for family reunions. That's a mass movement of people that will increase the spread of the virus. If we cannot control the situation well, there will be a peak in new cases. Now experts, the city government, and the Disease Control Center are working on how to deal with the situation and reduce the risks.
So far, Shanghai has reported 9 coronavirus cases, with all patients in a stable condition. Another 10 suspected cases are waiting test results. The city has set up temperature scanners at all airports, railway stations, and intercity bus stations. People with a fever are registered and tracked.
We strengthened the training of the medical staff to work on the test of the pathogen. It is very important to diagnose and isolate a coronavirus at an early stage. Also, we should particularly take care of medical staff.